Hi and welcome to episode 31 of the Fat Doctor podcast. I've had a lovely couple of weeks off. Don't know about you. And I'm back, feeling good. For those of you watching the video, you might notice that I have done some redecorating. And by redecorating, I mean I've hung up my keffiyeh over my door. Sort of, 1990s teenage style, I'm just going to drape a garment and that will be my version of redecorating. I'm also wearing, and you can't really see it in the video, but it's a t-shirt that says nature is my religion. And I'm feeling really good about myself. Just feel like I'm in the right frame of mind to record this podcast is what I'm trying to say. I'm a bit hot and sweaty. I mean, it's life. I have this light on. Oh, it's a bit better. I've got this light on. It's very bright. Maybe I can turn it down a bit and maybe I'll be less hot. But the things you do for your YouTube channel, that looks better. Slightly flush now, you can see. So, welcome back. I have had a couple of weeks to just gather some inspiration, and I'd like to say that I gathered more than I did. I have some inspiration. I have some things to talk about. I really need to get a guest on. That's one thing I'm thinking. I haven't had a guest for ages. I need to get some guests on. We'll be doing that. But unfortunately today is just me again. If you're still listening to my podcast all these years after me first starting it, you've stuck with me. You know what you're in for. I don't need to explain. If you're new to the podcast, welcome. Come on in. Join us. I had an idea that I was going to talk to you a little bit today about how to interrogate doctors' statements. And the reason is because doctors make statements all the time, right? Like they say stuff. We say stuff. Just say stuff. Sometimes we're not really giving much thought to what we're saying. We just say it. Sometimes we really think we know what we're talking about. We really think we've done it. Sometimes we think it's a real flex as well. Sometimes we're very proud of ourselves. Woohoo! Yeah, I said that. But just because a doctor said it doesn't mean it's true. I'm sure you all know that. Logically, you all know that. I wonder if you know that though. Do you know that in your heart? In your gut. Do you know that? But I think it's really important to interrogate doctor statements. And actually, we as doctors need to accept that if people are going to respect us and if they are going to listen to what we have to say, then our statements should be open to interrogation. Right? People should be able to ask questions. People should be able to ask, what else could be true at this moment? Like, could you be wrong? Sorry. If you're a doctor and you're listening to that right now, it must have hurt. Tasted like vinegar. But it's true because doctors are often wrong. Yeah. And sometimes they talk shit. But yeah, we as a society, we've been told to just trust the doctor, right? That was certainly the mentality that was passed down through generations. The doctor is always right. Trust what the doctor says. You feel almost obligated. And the doctor makes it very clear, I'm not interested in you questioning me. The validity of my statements. If I've said it, I've said it, and that's the end of it. And some doctors get massively offended. Those are generally the arrogant, narcissistic ones. Some doctors are like, all right, fine, but I don't really have time for this. I've got better things to be doing with my time. Very few doctors are just like, oh, you've got questions? Sure, bring them on. And also, I would like to point out, it's very difficult to do that in a consultation, to come up with questions, because, and we've talked about this in previous episodes, when you're in a doctor's consultation, it is an acutely stressful event. You are either in fight, flight, freeze, flop, or fawn mode, or several of those happening at the same time. Your brain is powered down. You're not thinking kind of outside the box. Right now you're thinking about survival. It's a survival thing. And so you probably aren't going to be able to come up with some clever questions to ask the doctor. Oh, why would you? Not in the moment. But you might go home, or maybe you get in your car and you have a little cry. Maybe you'll talk to people about it. Maybe you won't. Maybe you'll bottle it all up inside. But there might come a point in time where you can begin to question, actually, was that doctor right? And I have five questions that I think that you can ask, and I've kind of drilled down and really got to the heart of the matter here. They're very simple questions that I think you'll appreciate. The first question is, says who? I know the obvious answer is the doctor. The doctor says, yes, I get it, but says who? Just because they're a doctor doesn't mean they're right. So you need to ask yourself, hey, do I trust this doctor? And sometimes we have very good relationships with our doctors, and so we do generally trust what they have to say. Oftentimes we've never met them before, we don't have a particularly good relationship with them. So in of itself, that's like, well, they've steered me wrong in the past, so why would this time be any different? But if it's a doctor that you do trust, it might be a little bit harder. Not saying that they're correct, but, do I trust this person? Do I have any reason to trust this person apart from the qualifications that they have? Do I have any reason to trust this person? Was this doctor recommended to me by other people? Even those things like that, that's teasing a little bit. But actually, you need to ask yourself, is this a fact that this doctor has shared with me? Is it a fact? Like, here is an X-ray. Here is a fracture. Fact, right? Or is it an opinion? It could be an educated opinion or guess. It could be a guesstimate, or an estimate based on evidence. Or it could just be like, this is what I think. Right? So it could be a fact, like more or less, or obvious. It could be an educated guess based on evidence, an evidence-based educated guess. Or it could just be an opinion. And so you need to ask yourself, which one was it? And we're going to go through some examples later. So I'll give you some examples of this. And here's the really important question. And I think this is the question you need to ask yourself. Whether you trust them or not, whether they've been good in the past, all very well and good. But the question is, does this statement line up with what I know to be true or what my body is telling me? Because nobody knows your body better than you do. Nobody. So if it's lining up with what you believe, great. If it's not, I'm not saying it's wrong. I'm just saying, we might have to do some further digging around and interrogating, because your body knows what's best. Your body knows what's right. You know what's right deep down inside. If you think something and the doctor's like, no, you're wrong, that's possible. But there's a good chance the doctor's wrong and you're right. Okay? So that's the first question. Says who? Just because the doctor said it. Says who? All right? Next question is, what else could be true? Because lots of things could be true at the same time. And I think doctors can be very binary, very black or white. It's this or it's this or nothing, And it's interesting because we often have what we call a differential diagnosis. So there's lots of things that could be causing these symptoms. And so we have to go through that differential diagnosis and basically go, that's unlikely and that's possible, or we need to do a test to look at this. But that's how we work. And we actually work with a lot of uncertainty. Doctors constantly work with uncertainty. And I don't know whether it's a way of managing that uncertainty or not. Oftentimes we make these very bold, black and white binary statements. If you don't do this, then this will happen. Like, geez, there's no way to predict the future. How could you possibly say that? So lots of things could be true at the same time in any given situation. And sometimes it's obvious. There is a fracture on an X-ray. I mean, other things could be true, but probably not. And sometimes most of the time it's far less obvious. So many things could be true at the same time. So that's what you have to ask yourself. Like, what else could be true? Did the doctor blame you, or are you blaming yourself? If that is the case, then that's a red flag. That's a red flag right there. Blame, shame, any of that should not exist in medicine. Stigma, no, there's no place for it in medicine. So if you come away from a situation and maybe you can't quite put your finger on it, but you felt very much like you were blamed, you were shamed, you were stigmatized, red flag. Something else might be true. Like, for example, the doctor might be prejudiced. The doctor might have issues, not you. I'm checks notes. So you just, what did I say? What else might explain the situation? The other thing that you need to ask yourself is it really that serious? Because doctors can often over-dramatize, catastrophize things, right? Oh, they're overestimating the danger. If you don't do this, you'll die. Really? Really though, will I? What are the chances? Really, the chances. So, doctors have a tendency to catastrophize anyway, like we have issues. And so are they overestimating the risk? Are they overestimating the implications? Are they overestimating the benefits of a medication or a treatment or a procedure? Oh, this will fix everything. Will it though? Life is often far more messy than that. And so most of the time it will not fix everything. It might fix some things, but not everything. So if a doctor's promising you that it will, that's again, red flag. overestimating. So you need to interrogate these statements. You have to ask yourself what else could be true and write a list. What else could be true in this situation? Just write everything else that could be true. So that's the second question. The third question. This is very Asher-like. So what? If this statement turns out to be true, so what? Does it mean I have to act? Does it mean I have to react? Could it just be a thing? Again, let's go back to the fracture. You have a fracture. Here it is. I'm showing you a picture. Like, you could be like, so what? But I mean, if you don't fix it, then it's going to heal wrong and you're going to have problems down the line. So it's obvious. You do need to act. And I know very few people who'd be like, do you know what? Skip the cast. I'm not interested. Most of us just go and get the cast, right? Okay, I broke a bone. I'm going to get it fixed. Pretty straightforward. But that's, medicine is very rarely that simple. It's great to work. I used to work in the emergency department, in the minors department. And someone will come in, they'd have an injury. Is it a sprain? Is it a fracture? Very simple. Do an x-ray. It's a sprain. This is what you do. It's a fracture. This is what you do. Very simple. It's fun medicine in the sense that it's just like a flow chart. You just follow the flow chart and you end up at the right destination every time. But that's not what most of medicine is about. And many of you who are listening or who have complex symptoms, complex medical conditions, maybe you're neurodivergent, maybe you have a disability, maybe you have an invisible disability, maybe it's hormonal, who knows, there could be so many things that's going on. And so, do you have to react in this situation, or could it just be something that is there and that you just accept it? Just, what if I didn't do anything in this moment? That's a question you can ask. What if I just didn't do anything right now? What would happen? What if I just left it alone? What then? And sometimes we have a lot of fears. Oh, if I don't act, this is going to happen. And with clients, sometimes I'll be like, all right, what's the worst case scenario here? And then they tell me the worst case scenario. And then the first thing I ask them is, okay, is that true? Is that actually going to happen? Or is that just catastrophizing? But even if it's true, I ask them, all right, then let's just say worst case scenario happens. Then what? Is it the end of the world? There's a phrase that I like to use. I wrote it in my notes. Is it a horror or is it a hassle? Where did I write it? I wrote it down somewhere. I think it's in the next bit. I think I might have gone ahead of myself. But is it a horror or is it a hassle? Right? Is it the end of the world? Or is it just like a meh? Not great, not ideal, but it is what it is. And that's important because when you're making an informed decision about something, you have to ask yourself, well, what happens if I do nothing? That's one of the questions you need to ask yourself. But often that's not an option that's given to you by a doctor. All right, so we said, so what? And the next question I think is very similar-ish. But this is more about and what? And what? You have to kind of puff up your chest, be like, and what? And what, friend? And what? Again, we've asked ourselves previously, do I need to act on this information? You need to also ask yourself, as I said, is this a hassle? Is this, or is it a horror? If I don't act, what will happen? Is it a possibility or a certainty? All of these things. Do I need to do something in this situation? So I've got my worst case scenarios in the so what portion, and I thought I skipped ahead a bit, but the and what is let's think of all the different options that I have. Let's be logical about this. My autistic self is just very happy in this moment. Let's be logical. These are all the different options and what happens. Follow them all the way through. I could do nothing, I could do this, and then we follow them through. And I'm going to have some examples, so we'll talk about that. And the last thing I want you to do, if you want to, only if you want to, it's all consensual, friend. Only if you want to, you could ask yourself, can I reframe this statement? Can I reframe it? And sometimes, a doctor will make a statement or there's a risk, there's a 10% risk that this could happen. But also there's a 90% chance it won't happen. 90%. So it depends on how you look at it, right? So we can start reframing things. We can stop being so black and white. We can start asking, we've asked ourselves, says who? What else could be true? So what? What's the worst case scenario? And what? Do I need to do anything about it? And then we can begin to reframe the statement in our minds. And one thing you could ask yourself is, what would I say to a friend in this situation? If they told me that, what would I say back? Another thing you can ask yourself is, what would a loved one say to me in this situation? You know, like, pretend it's not happening to you, because like there's the guilt and the shame and the blame and all of this stuff, and we're not very good at being kind to ourselves, are we? Let's be honest. Being kind and compassionate to ourselves is not something that we're all particularly good at. So let's put that to one side and pretend you're doing it for someone else. It's often easier. What would you say in this situation? And sometimes when we do that, we're reframing the statement into a slight, you know, we're just tweaking, sometimes just tweaking the words just a little bit can feel very different. It can feel different. And that's really important. So I want to give you some examples. I've come up with some examples. I was using a silver pen. How unhelpful. I was journaling and I thought I'd use a silver pen, but now I can't read them. All right, some examples. And we're going to go through Asher's system. This is a system I came up with, by the way, whilst I was scribbling in my journal. It's not some kind of well-developed framework. It is a framework in the making, perchance, maybe. It's actually something that I was asking myself because I was feeling really bad about something. And so I started asking myself these questions, and then I was like, this is actually quite helpful. Maybe we could try that with like medical stuff as well. So anyway, let's go. Here's a statement. Your blood tests show that you are pre-diabetic, and if you don't lose weight in the next few years, chances are you're going to have a heart attack soon in the next 10 years. Right, that's the statement. Blood tests show you're pre-diabetic. We need to do something. We need to act on this straight away, because if we don't, you're going to have a heart attack. Big statement. Best question, says who? And if you've been to any of Asher's masterclasses, you will know that pre-diabetes is not a thing. It's not a real thing anyway. So that's something that could be true. Something else that could be true is you're not going to develop diabetes or have a heart attack because you've been to Asher's masterclass and you actually know that there is evidence which shows that losing weight is going to have absolutely zero impact on whether or not you have a heart attack over the period of 20 years. In fact, if you are quote unquote pre-diabetic, there is an entire study that's looked at this, and we know it for a fact. Yeah, fact, but you know, educated guess. Was that what I say? Educated, yeah, guess. So, says who? Or do I trust this doctor? What are these doctors' motivations? Does it line up with what I know? And if you've been to Asher's masterclass, the answer is no, does not. What is your body telling you? Your body's probably panicking. You're probably like, but once you've calmed down a little bit, like, do you think you're going to have a heart attack in the next 10 years? Realistically speaking, do you think you will? I know we're all scared, but like, do you think you will? I ask my patients this sometimes, my clients. I'll say to a client, but do you think it's going to happen? Like, honestly, no, just tell me the truth. Just deep down inside, just answer yes or no really quickly. Do you think it's going to happen? And most of them will go, no, I don't. And I'm like, yes, that's correct, because it probably won't. So what else could be true? Am I blaming myself? You know, there's a lot of shame and blame when it comes to pre-diabetes. What else might explain the situation? My sugar's a little bit high. Maybe I'm stressed. Maybe I'm, maybe it's hormones. Maybe it's this. Maybe it's that. Again, if you've been to one of Asher's masterclass, if you've done the Navigating Insulin Resistance masterclass, you will know that there are many reasons why your HbA1c might be high, and you don't, and being at risk of diabetes is just one of the possible things. There's plenty of other explanations, and people can go back into sort of like normal glycemic range, 10 years down the line, 11 years down the line, whatever, 15 yees down the line. So is it really that serious? Your doctor has probably made it out to be really serious, but is it? Again, like, you need to ask yourself that question. Are they overestimating the danger? Damn right they are. They are catastrophizing, and they're doing it for a reason usually. They are catastrophizing when they shouldn't be. So the CDC data shows that, within 5 years, 10% of quote unquote pre-diabetics will develop diabetes. And for those, it was inevitable. 90% of people won't. So the next thing you need to ask yourself is, so what? Now, I don't know about you, but I don't want to have a heart attack. So that's a big so what. Like, worst case scenario is I have a heart attack and that doesn't sound good. Would I survive? Probably. Would I cope? Yeah, probably, but it's not something I want. So the so what is actually like, ooh, not great. But that's assuming that the statement is true, and we're pretty convinced that the statement is not true. But the so what is a bit like, So then we have to ask ourselves, and what? Do I need to act or react on the situation? So based on what I have come up with. And so we give ourselves lots of options. Number 1, I do nothing. Number 2, I lose weight like my doctor suggested. Number 3, I find an alternative option for managing my insulin resistance. Number 4, I book an appointment with Dr. Ashalami. It's an option, just saying, putting it out there. This is my podcast after all. But like, you can go through all these different scenarios and you can find the one that suits you. You can explore them all if you want. But if you're going to explore, all right, fine, I'm going to try and lose weight. So what happens if I try to lose weight? Chances are I'll start off really good and then it will start to plateau. And then a couple of years from now, I'll be right back where I started. Or in many cases, I'll end up heavier than when I first started. It's not going to have much of an impact. In fact, if anything, it's going to have a negative impact on my insulin resistance. So that's like, you're going through all your different options. So can you reframe the statement? I've been diagnosed with prediabetes, which may or may not actually be a real condition. And losing weight is an option, but not one I'm interested in exploring. So I will do X, Y, and Z. That's off the top of my head, by the way, folks. Like I'm not going to do the reframing. Maybe I should just say press pause and frame it yourself. No, it's not a course. All right, let's go for example number 2. I've written them down in silver. All right, yes, no, I know what that says. Doctor says to you, you're anemic. And does a prescription says, here's a prescription for iron tablets. You want to take one twice a day for the next 3 months and you'll feel better. That's reasonable, right? At first glance, you take the prescription, you go and fill it, you go home, you take the first tablet. Why would you question that? We are going to interrogate the statement now, friends. So, says who? The doctor. Is it a fact or an opinion or evidence-based? Well, let's face it. Like, we know the diagnostic criteria for anemia, and if your hemoglobin is below a certain number, cut off, depends if you're male or female, but then you're anemic. That's the definition of anemia. So it's pretty much a fact, right? It's kind of like a broken bow. It's there. Here's the blood test to show it to you. Is that what is causing your symptoms? Because, like, if they've just picked it up randomly and you were fine, you're minding your own business, and this was picked up in a routine screen, you might be like, huh? I feel fine. But maybe you'd gone to see your doctor because you were tired all the time, and then they did it and they were like, you're anemic. You're like, that would explain it. So that, it depends. You have to ask yourself, like, does this statement line up with what I know to be true and what my body is telling me? Is my body telling me that I'm anemic? And I know this might seem ridiculous because you might be like, yeah, but you are anemic. So what does it matter what your body is telling you? But we don't have to treat everything. We don't necessarily have to treat anemia, or we might choose a different option. So is my body telling me that I'm anemic? I'm absolutely knackered and I get short of breath when I climb stairs. Yeah, your body's telling you that you're anemic. And what else could be true? And this is actually an important one because, like, you told me I was anemic and you gave me some iron tablets, but why am I anemic? You didn't actually tell me. Like, what else could be true? Could it be something other than, what, like, you didn't explain it? What could be true? What could be going on? Is it my diet? Am I bleeding from somewhere? Is it because I've got heavy periods? Or, is it because there's an underlying cancer that you miss? Like, there could be lots of reasons why you're anemic. So, you might want to explore those questions. Is it really serious? What will happen if I don't do anything? Did you ask your doctor that? Probably not, because you weren't thinking straight in the consultation. But did they explain, like, you could just not take these and, so what? Like, they didn't explain. So what? I'm anemic. So what? What does it mean? What happens if I don't treat it? What happens if I do treat it? What are the different ways that I can treat it? What's the worst case scenario if that happens? Like, again, we're interrogating that statement. And what? What do I do? So you could just take the iron tablets like your doctor told you, but there might be alternative options. Did your doctor mention that those iron tablets are going to cause severe constipation? Because chances are they will. Gastrointestinal side effects. You might feel really nauseous when you take them. That's if you take them once, twice a day. So did your doctor say to you, look, you're not feeling that unwell at the moment. We just picked this up on a routine screening. We don't need to treat immediately. We could try this and that. Or you could massively reduce the amount that you take. So you take half a tablet once a day instead of 2 tablets a day. Or we could try diet first. Or we could do it. Like, what are the options? You've just been told you're anemic and given a prescription. You've just gone home and taken it. Of course you did. Why wouldn't you? That your doctor just handed you a piece of paper or whatever. Did it electronically probably now. And that's the end of it. But You didn't interrogate the statement, and therefore you don't know what the best options are for you. So reframe it. I'm not going to reframe it. I'm going to go on to the next option. The next example. If you don't stop smoking, you'll get lung cancer. So, says who? Says everyone, right? I mean, packet of cigarettes has pictures of, like, you know, dead babies and all sorts of awful things in it. Everyone agrees that if you don't stop smoking, you'll get lung cancer. But that's not a true statement at all. I just want to point that out. That is an opinion at best. It is not a fact. Yes, the risk of lung cancer significantly increases if you're a smoker. By that, what I mean is if you look at all the people diagnosed with lung cancer, almost all of them are smokers. It depends on the kind of lung cancer, and it's not always the case, and some non-smokers get lung cancer, but for the most part, the majority of people with lung cancer are smokers or ex-smokers. However, the majority of people who smoke don't go on to get lung cancer. Do you see the difference? It's a big difference. And to tell somebody that they're going to get lung cancer is catastrophizing. You are misleading them. You are overestimating the danger. Now, you can say, I don't know what the statistic is, by the way, but if you keep smoking, the chances of you developing lung cancer are whatever it is. I don't know what it is. That's fair. That's a reasonable statement. That's evidence-based. But you're going to get lung cancer is an opinion, and it's a incorrect, inaccurate one at that. So what else could be true? What else could be true is you could not get lung cancer. What else could be true is you could get COPD, chronic obstructive pulmonary disease. What else could be true is it could increase your risk of having a heart attack. Again, this is evidence-based stuff. But it doesn't mean you're going to get lung cancer. Even if you have a family member who had lung cancer, still doesn't mean you're going to get lung cancer, right? So you need to interrogate that statement a little bit. Now, I'm not pro-smoking. I'm not being sponsored by Big Tobacco. And I'm not anti-smoking either. Guess what? I'm neutral. I'm very neutral. If you ask me what's a good way to reduce my risk of heart disease, I might say to you, are you a smoker? Yes. Cutting down your smoking or stopping smoking is going to massively reduce your risk. And I've got the evidence to back that up. But I'm not going to tell you to stop smoking, otherwise you'll get lung cancer. That's a completely inaccurate statement. And so what? So, I mean, lung cancer is a big so what? Like, nobody wants lung cancer. But what if I don't stop smoking, you know? And, you know, what if the worst did happen? Are you willing to take that risk? There are some people that are like, look, smoking gets me through my day-to-day life. If I stop smoking, I will not be able to cope with my day-to-day. Who cares whether I get lung cancer 20 years from now? I will probably end my life a year from now. Smoking is how I stay off drugs. I smoke instead of using heroin. If I stop smoking, there's a chance I might go back to heroin. Right? Risks and benefits, right? Like, I mean, there are lots of reasons why people smoke. And so we need to take all of those into consideration. Excuse me. And what? What are we going to do about it? Well, you could stop smoking. You could continue smoking. Those seem to be the only two options. You could switch to vapes. I don't know. I think we'll move on to the next example. If you lose weight, your back pain will improve. Now, I think this is one that a lot of us can relate. You can take back pain out and put something else in there. Endometriosis, I don't know, stick anything in there. Knee pain, tiredness, anything. Insert symptom here. If you lose weight, your back pain will improve. So, we'll go through it. Says who? A liar. No. What kind of doctor is this? Is it a fat-phobic doctor? Most doctors are fat-phobic. But do you have evidence that suggests that this person is fat-phobic? And the answer is probably yes. Do you have evidence that this doctor's fat phobia is influencing what they're saying? Which is a little bit more tricky and complicated. But is it a fact? Is it opinion, or is it evidence-based? Does this statement line up with what you know to be true or what your body is telling you? Now, when it comes to what you know to be true, if you follow along with this podcast, or you know anything about me, or have read anything that I've written, and it's not just me, I'm not the only person talking about it. If you're, following along with my good pal Regan Chastain, if you're following along with any health at every size sort of dietitian or healthcare professional, and they might not call themselves health at every size. They might call themselves weight inclusive or whatever. But if you follow along with any of us, you know that there's a huge body of evidence that says that is completely and utterly bollocks. No. Losing weight is not going to improve your back pain. No. And here's all the different reasons why. And I've talked about this in the past. There's blog posts, there's videos, there's probably podcast episodes. It's not going to work. Losing weight isn't going to help. So it does not line up with what you know to be true. First thing. Second thing, what else could be true? So many things. And in this case, I think we talked about this in a couple of episodes ago, when you write down a list, what I call like your differential diagnosis, what could be causing your back pain? Write it all down. Every single thing you think could be causing your back pain, you want to write every single one of them down. So all of those could be true, right? And also, interrogating the kind of the validity of that statement. Often, was it black and white? Was it a very binary state? If you do this, then this will happen. Like it's a red flag, because there's no room for the kind of complexity of the human body there. This might happen. I mean, if you used might or may possibly use that kind of language, then maybe it's less of a red flag. But if you're saying it will, then that's a huge red flag, in my opinion. Because it's A, not evidence-based, and B, doesn't make room for the complexity of the human body. So this doctor has made a statement. If you lose weight, your back pain will improve. If the statement is correct, we'll just put aside all the things that we know now. If the statement is correct, does that mean you should lose weight? And here's why. Because we know that attempting weight loss will have lots of negative impacts on us. Short-term and long-term. Physical, mental, emotional, financial, you name it, social. Attempting weight loss has lots of negative impacts. Do the risks of weight loss make it worse? Like, are they going to make things worse in the end, is what I'm trying to say. What am I trying to say here? So you've got back pain. But if you try losing weight, you'll also have X, Y, and Z. You might develop gallstones, or this will happen, or this will happen, or this will happen. So, or they want to give you surgery, and there are all sorts of risks. So just because, even if it were true, even if weight loss does improve back pain, which it doesn't, but even if it were true, does that mean you should do it? Not necessarily. You have to explore all the other options, and that's the next thing. And what? What are my options? Weight loss is one of them. I've written a differential diagnosis. Have you actually bothered to rule out any of these other things? That's another option. You could do your job. Look for other causes of my back pain. Another option would be like, well, weight loss isn't an option. What else can we do? Because there's so many other options, right? There are other ways to manage your back pain. Believe it or not, weight loss is not the only solution. If you're a thin person, they'd be offering you something else, right? So you need to start interrogating the other options, looking at the other options. I think I've made my point clear at this stage. I hope that was helpful. I hope that you've listened to this and you've come away thinking, I don't have to listen to my doctor every time they talk to me. I don't have to do what they say. I don't have to take that prescription and fill it. And even if I don't, in the moment, come up with the questions, because I don't come up with the questions, and I'm the bloody doctor. So you're not going to come up with the questions in the consultation. But it's okay to go away. It's okay to have a think about it. It's okay to weigh up all of your options. It's okay to think of alternatives. It's okay to go back to that doctor and go, I know you gave me that prescription, but actually I would like to discuss this, that and the other. And I know for many of you, that means you're going to end up talking to some internet type thing. You're going to be doing you'll be filling in an e-consult, or you'll have a message board where you can talk to your doctor electronically, or you might not necessarily get a satisfactory response. Maybe you'll end up talking to a nurse practitioner or an administrative, an admin member of staff rather than a doctor themselves. But you can still absolutely, without question, go back to your doctor and go, do you know, I've had some time to think about this and I've got these questions. That's totally okay. You don't have to do what the doctor says. And as I said before, I'm a doctor. I'm a doctor that cares about you. And so if you've got questions, you could always come to me. I can't give you prescriptions. I can't do tests. That's not possible. But I can absolutely listen to what's going on and offer you suggestions and support and ways of, moving on, like, discussing or exploring the alternative options with you. Now, I can't tell you what to do. I'm not your doctor. I can never be your doctor. I'm not going to be your doctor. But I can help you to advocate for yourself, to explore, to interrogate these statements with someone, and to explore what you're going to do next, especially if you hit a brick wall with your own doctors. So yeah, I'm around. You can book a consultation with me. You can book a free kind of discovery call first if you're not sure what you want to do. And then we can go from there. Yes, indeed. Also, if you've got a particular symptom or condition, I do masterclasses once a month, and you can now join my masterclass membership. And if you do, you get access to every single masterclass that happens every month, but also you get access to all the previous ones as well. So you can go back and you can watch all the other ones as well. Did you know that? You can. If you go to learn.fatdoctor.co.uk, there's a whole bunch of stuff on there. Courses, free stuff. So yeah, learn.fatdoctor.co.uk. Why not have a little look, little nosy around? And final thing, I can't remember what the final thing is. Oh dear. Oh yeah, if you are subscribed to my email list, then you get an email from me every day. And sometimes I'm telling you about an offer I've got going. Sometimes I'm telling you about a masterclass or a this or a that. Yeah, but I'm also giving lots of information. I'm just giving it out for free. So you could read something from me every day if you want to. You could also head to my YouTube channel at The Fat Doctor UK. Oh gosh, I should know that, shouldn't I? YouTube, your videos, you at Fat Doctor UK, at Fat Doctor UK. Slightly different to my Instagram, which is at The Fat Doctor. I wonder if I can change that. It would make life easier, wouldn't it? No, I can't, because there is a Fat Doctor on YouTube already. That's why. So I couldn't do it. Ugh, terrible stuff. Anyway, yeah, I've got stuff on YouTube as well. I've got a blog on my website once a month. Do a blog. All right, I'll stop now. See you next week, folks. Oh, you won't see me unless you're watching YouTube, but never mind. Catch you at the next episode. Bye-bye.